Several years ago, Mario Cuomo, the former governor of New York, said to the graduates that, quote, "A commencement speaker should think of themselves as a body at an old-fashioned wake. That is, they need you in order to have the party, but nobody expects you to say a great deal." So I understand my place in this ceremony, and I will not greatly delay your celebrations with your loved ones. Let me say, first of all, what an honor it is for me serving in this position. As a fellow alum of the medical school, I have a deep commitment to carrying on the GW Medical School tradition of creating outstanding doctors. As I was thinking about my charge, many possible themes came to mind. However, as my remarks fall immediately before the recitation of the Hippocratic Oath, I thought I would try to put the oath into context for you and your families. The Hippocratic Oath is one of the oldest binding documents in history. It is the most enduring tradition in Western medicine and has been the guiding ethical code for physicians since ancient Greece. The oath became the core of all medical ethics, and according to the American Medical Association, has remained in Western civilization as an expression of ideal conduct for the physician. The oath is a rite of passage for physicians, although nowadays the modernized version of the text varies among countries and even among U.S. medical schools. Indeed, GW has two versions of the Hippocratic Oath. 2 years ago, a group of students and faculty revised the version that you are to recite today. Last year's graduates recited our new version. However, I prefer the cadence and the tradition of this version. The essential ethical tenets are the same in both versions, however. So what will you be pledging? The Hippocratic Oath covers several important ethical issues between doctors and patients. It first establishes that the practitioner of medicine give deference to teachers and learners of medicine, thereby emphasizing the profound nature of the medical covenant and ensuring that the physician does not forget his or her place in the long line of tradition in medicine. The oath serves as a contract for doctors to work toward the benefit of the health of the public. Other important tenets include maintaining the integrity of the doctor and the dignity of the patient, ensuring patient consent, preventing the exploitation of the patient, maintaining privacy, confidentiality, and discretion, and forbidding deadly drugs and procedures. It emphasizes the physician's responsibility to guard against abuse or corruption of his or her knowledge and art, and requires the physician to treat the sick to the best of one's ability. Regardless which form of the oath was utilized throughout history, it has set the standard for the field of medicine that has survived through the ancient world, the Middle Ages, the Renaissance and Enlightenment, through 2 world wars, and through the greatest period of scientific discovery. As one writer said, the oath is a declaration of virtue based on faith and self-respect. It remains a commitment to the idea that there are ideals and principles in the profession of medicine, a heritage worth claiming, end quote. As Dean Schroff mentioned, 4 years ago you walked across this stage, donned your white coat, signed the medical school's honor code, and recited an oath created for students, faculty, and alumni of the School of Medicine and Health Sciences. Today, we complete your GW medical school experience with the powerful reminder that ethical behavior, professionalism, self-awareness, and service are and will continue to be at the core of the physician identity. And so, graduates, I charge you to always put patients first. And remember that there is a reason that your education at GW Medical School began with the signing of our honor code and concludes with the recitation of the Hippocratic Oath. I charge you to expand and go beyond that sense of advocacy, altruism, and service that brought you to GW for medical school. Strive to be the physician activist that makes you an impact beyond the exam room. I charge you to be self-aware. Do not let pride or your insecurities interfere with your ability to ask questions or ask for assistance. Your capacity to provide the safest and highest quality care requires that you push yourself toward a lifetime of learning and that you work effectively with your teammates. And doctors, as a psychiatrist, I charge you to play, to have fun, and not take yourselves too seriously. If there is one thing that I hope you have learned in medical school, it is that life is too short and too precious for it to be all about work and no play. And so the tradition continues. At this time, it is traditional for the graduating class to take the oath of Hippocrates. However, it is also a GW tradition that we ask all other physicians in the audience to reaffirm their vows, along with the graduating class. We will ask that several groups of physicians please rise to say the oath of Hippocrates. Please stay standing until after the oath is completed.